Hello everyone. Today we've had a lot of questions recently about hair grafts or hair transplantation, or what is the best method, or what is it really and how does it work? Well, the method that we use that is the safest and basically is no incision type procedure is called FUE. That stands for Follicular Unit Extraction, which means we're taking little hair follicles from one area of the back of the scalp where there is hair and then transplanting them to areas that you need more density, more growth, especially the frontal hairline, the crown area. And what makes this very unique and a very nice procedure is that, one, we don't have to make an incision. Basically, we use a small mechanical-like robot in which it takes each graft, we then section them with our technician, and then we implant them in the areas that we have marked into the scalp. 95 to 98% of these grafts take, which is amazing for anything that can do that kind of results. Also, when you have this done, by a week, the little scabs that you've had after you implant kind of flake off, and you really don't see anything, and you slowly get hair growth over time. And by 6 months, you're starting to see new growth. Remember, your hair takes time to grow in, and then by a year, you see the new growth. Now, we do the taking of the grafts and the implantation all at one time in one sitting. You do it in the office, you go home. There are instructions where you have to kind of do certain things to take care of the grafts and make sure you don't disturb them for a few days. But by 5 days, basically, you're back to normal activity. Now, FUE, Follicular Unit Extraction, is different from where we used to take a little scalp incision, take a whole unit out, and they have to take sutures and close it. That was a little more traumatic. If you ever wanted to wear your hair a little short, people could see it. So this is a much better advance, very more straightforward for my patients, and they really enjoyed the natural results. And what's even best, remember I said 95 to 98% of the grafts take, and it's long lasting. Basically, where we're taking the grafts from, they never are going to fall out or shed. So our patients that are coming in these days with needing hair grafts or want a consultation are those from any age now, from mid-20s, early 30s, all the way up to 65, 70. Because it's your own hair and you're not going to reject the grafts will take almost at any age. Now, what about if you have an autoimmune disease, or you're taking some medication that may not weaken your immune system? Of course, that may affect the results somewhat. We just have to look at what the situation is. Even smokers that we have done have up to 95% take on these grafts. It's amazing because it's your own tissue. We're grafting them, we're taking them, and they're putting them in all at one time. Now remember, if it's an area where you have some loss of hair and you still have some hair there, that may continue to lose a little bit. So be aware that area may have to be grafted again, because the hair that we take from the back of the head is not going to ever need to be grafted again.